हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन। आज हम डिस्कस करेंगे मेडिसिन के सम इम्पॉर्टेंट एमसीक्यू। विच ऑफ द फॉलोइंग इज करेक्ट रिगार्डिंग पल्मोनरी एंथ्रेक्स प्रेजेंटेशन? लोबार निमोनिया, ब्रोंको निमोनिया, एटिपिकल निमोनिया, हेमरेजिक मीडिया mediastinitis. Best answer is the hemorrhagic mediastinitis because if the patient present clinical presentation is highly suggestive of the pulmonary anthrax presentation, the highly suggestive of the hemorrhagic mediastinitis. Anthrax is a zoonotic occupational disease caused by a rhodocephalic aerobic gram-positive spore-forming organism called Bacillus anthracus. Next question: a 50-year-old HIV positive male comes to OPD with complaints of fever, breathlessness, and non-productive cough for 2 weeks. He is diagnosed with a case of pneumocytic cerevisiae pneumonia. At what CD4 T cells primary prophylaxis for the condition is recommended to be started? क्या less than 20% and less than 15%, 5%, 50% and 10%? क्या होगा 20%? बिकॉज द न्यूमोनिया जीरोवैसी क्या है? ये ईस्ट है. इज ईस्ट लाइक फंगस इन्फेक्शन रिस्पॉन्सिबल फॉर कॉजिंग न्यूमोनिया, pneumocystis pneumonia and diffuse intestinal pneumonia. It is the most common opportunistic infection है. क्या ये opportunistic infection है? In patient with HIV, because immunosuppressant are risk factor, the symptoms are non-specific and can include progressive exertional dyspnea, fever, non-productive cough, chest discomfort and hemoptysis. क्या आप देख सकते हैं? hemoptysis, fever, cough, chest pain and diffuse bilateral ground glass opacity. कैसा था यहाँ पर? diffuse bilateral ground glass opacity are appreciated on chest radiography and diagnosed by the lung biopsy or bronchoalveolar lavage. It is associated with increased morbidity and mortality if we left untreated. Next question: an HIV positive male admitted to the ICU with septic shock secondary to lobar pneumonia is being mechanically ventilated after 2 days of intravenous ephedrone, trimethoprim, sulfamethoxazole and erythromycin. His fever has resolved. Blood culture are positive for S pneumonia. SPO is 92% on room air and BP is 80/40 mmHg. Despite adequate fluid and 2 mcg per kg per minute of norepinephrine, further examination reveals warm skin and full peripheral pulses. What is the next best step in management? Order a CT scan for the sinuses, co-stopping stimulation test followed by hydrocortisone 100 mg and intravenous every 6 hours. This one is the best answer because if the patient has a condition known as distributive shock. क्या known हो जाएगा? distributive shock which presents with the adenosis crisis, which is characterized by decreased production of cortisol and aldosterone from the gland. Therefore, the hormone replacement is required. Distributive shock results from excessive vasodilation and an impaired distribution of blood flow. The most common cause of distributive shock is sepsis and anaphylaxis. Adenoinsufficiency can also result in distributive shock. An Addisonian crisis result to a medical emergency with acute adenoinsufficiency of cortisol and glucocorticoids. An acute stress event and can precipitate it. The condition is highly critical if the patient is ill. Next question: a 31-year-old male presented to the clinic with fever, productive cough, hemoptysis and breathlessness. The X-ray revealed evidence of total high upper lobe consolidation. Sputum microscopic culture and blood culture confirmed Friedland bacillus as the etiology of the severe community-acquired pneumonia. Friedlander pneumonia refers to the pneumonia caused by Klebsiella, Streptococcus pneumonia, Haemophilus influenzae and Staphylococcus. Here the best answer is the Klebsiella because the Klebsiella pneumonia is also known as क्या? Friedlander pneumonia, which refers to the pneumonia caused by the organism Klebsiella pneumoniae. A gram negative क्या है? ये gram negative rod shaped bacillus है. rodshed bacillus. The prevalence of disease is higher in older adults and colleagues and those immunocompromised patients. It is transmitted through person to person contact, but can also contaminate ventilators. Transmit होता है person to person, और and the contact can also contact ventilator से ureters or IV catheter. The most common symptoms include fever, chills, cough, chest pain, shortness of breath, and mucus production, which is a thick reddish brown due to blood. It is known as currant jelly sputum. Next question: A man presents with a history of throat infection a few weeks back with fever, headache, and unilateral parotid gland swelling, also accompanying of multiple joint pain and cough with very low sputum exportation. What is the next best step management? PCR of respiratory secretion, gram stain of transtracheal spirit, culture of transtracheal spirit, and chest X-ray. Best answer is PCR of the respiratory secretion. The here given clinical scenario is mycoplasma pneumoniae. Is the class caused by typical pneumonia, also called as silent pneumonia. Mycoplasma pneumonia is a pleomorphic organism and lacks a cell wall. And outbreak are more common in military requires regions and colleagues. It has a selective affinity of respiratory epithelial cells and damage the lining of respiratory system. Respiratory system डैमेज करता है और रेस्पायरेटरी epithelium को सेल्स को. It is transmitted होता है from person to person via respiratory droplet. The patient symptoms may include fever, malaise, persistent worsening, cough that can last for 6 weeks to month, indolent dull headache, chills, and pharyngitis. So today that's all. Thank you and keep revising.